Hello everyone, I'm Lottie Tizard. I'm the Digital Content Manager at Patient Safety Learning. And today I'm joined by Professor Paul Elkington, MBE, and he's a respiratory doctor and infection researcher. In this interview, we're going to talk about Paul's work to develop a new kind of respirator that really reduces the risk to healthcare staff of developing respiratory infections. So Paul and his team at University Hospital Southampton developed the PeRSo respirator, which stands for Personal Respirator Southampton, during the first wave of the COVID-19 pandemic back in 2020. So Paul, to start off, can you tell us what you were seeing that inspired you to develop these respirators?
Well, thanks, Lottie, for the chance to talk about this. So I was on the wards back in the early stage of the pandemic, and actually I looked after the first patient admitted to Southampton with SARS-CoV-2, and they were on the wrong ward with no PPE around, and it was very clear that we were going to run out of proper FFP3 masks and the kind of PPE we were recommended at that point. And because of my work on tuberculosis, I was familiar with pad respirators because we wear them in the labs in South Africa and in North America. And so I suggested with engineers that we needed to make some. If you recall, back in early March, that was when shipping was being shut down, flights were being shut down. So I actually said, can we make them from components in Southampton? And they made prototypes, which we then tested on the wards. And immediately the nurses were saying, I will give you cash for one of these. We unveiled a huge amount of anxiety, a huge demand for proper PPE. And that's how it all started.
Okay. And I think you've got an example of the PeRSo there. Do you think you could maybe show us what it looks like? And
So I mean, we made some homemade ones with batteries and filters, and then with commercial partners we made the proper version. So this is just a battery, a fan, and a HEPA filter. So the HEPA filter removes 99.9% of particles. It blows it up into a hood, and this is the one I wore in the pandemic. And you look faintly ridiculous. I don't deny that. You look like you're sort of going to the moon. But the extraordinary thing is the sense of comfort. So you have a nice cool flow air down your face, the improvement of communication because people can see your lips and facial movement, the better communication with patients. But actually in those early stages where the Italian doctors were dying, unfortunately, and you may remember the front pages of the papers with the first 20 healthcare workers in the UK who died, who were mainly from minority groups. And you'll be aware that FFP3 masks are designed for people like me, middle-aged males, and many groups failed fit testing. The most amazing thing about putting on the PeRSo was the sense of protection. And I can remember coming back from wearing one of the prototypes when people had laughed at me on the wards and then got their wallets out. And I didn't want to take it off because ultimately I was breathing fully filtered air and I didn't know what was around me, even sitting in this office. And the reason why 3,500 staff members in Southampton emailed requesting one, which is how many we had deployed in the second wave, is because of that sense of protection.
So it completely seals round your head and it filters the air that comes into that mask.
So you get clean air coming into this bubble around you, and then it just comes out through in the bottom of the face mask. There's a loose filter here, so the air comes up there. And so in actual fact, you are filtering the exhaled air. And it's probably worth mentioning, I think many of the comments in the public inquiry go against the peer-reviewed publications which we've made from this. So we systematically got user feedback, we got patient feedback. We showed that this was preferred by staff. We showed that our infection rate of staff members in our hospital was lower than comparator hospitals. We had better staff attendance because all of those people who failed fit testing could come to work. And we had hugely high staff satisfaction rates. And so after the pandemic, Southampton really bounced back quickly. We were performing 120% above most other hospitals in terms of turnover, because I think the staff felt they'd been looked after properly. So it's comfortable. And finally, I suppose the analysis is cost saving. After about 10 weeks, you've made the initial outlay, but then the running cost of changing the hood once every 3 months and the filter once every 6 months, but that's £10 each. whereas every time you throw an FFP3 mask in the bin, that's the money and the carbon footprint and waste generated. So one of my disappointments from the public inquiry is I think that the potential of these has not been recognised. And looking forward to the next pandemic, I think the government needs to change the regulations so that there are regulations fit for these powered respirators, both for the healthcare sector, but actually taking it one step further for mass population use, because they are so easy to use, whereas an FFP3 mask is uncomfy and leaks, that many people in society may choose to wear one.
So I was going to go on to ask you about how staff responded to using them, but you've
Sure.
kind of touched on that already.
Yeah.
That you know, you've suddenly had this demand, all these emails from people asking for them. Can you describe to me a bit more about what staff have said, like what feedback they've given you?
Yeah. So we, well, I mean, there was the non-quantitative feedback. So, for example, just after they'd been introduced, and so in the first wave, we could only use them to replace type 2R masks. And so, as you'll be aware, those masks do not protect against any airborne infection. And I went up to our red wards where we'd just introduced them, and I asked one of the healthcare assistants, and she said, "Oh, who are you?" And I said, "Oh, well, actually, I was involved in inventing these." And she said, "I could kiss you. I have been feeling sick with fear coming to work every day, now I feel safe." And there was feedback from people on intensive care in the second wave saying, "I don't think I could come to work if it wasn't for the PeRSos." So there was lots of anecdotes. We quantitatively collected feedback. So as we issued them, there was a link to initial feedback, and then everyone got an 8-week feedback. And this is all in a peer-reviewed publication in Frontiers in Medical Technology. People felt much safer. The downside is the cumbersomeness and the weight, and that's why a more sleek, quieter one. Ultimately, this is a welders blowers unit which has been repurposed for healthcare. So the feedback was 90% positive, and the downside of the cumbersomeness can be overcome in the future, but it needs central government leadership to do that.
So you've touched on this. Can you tell me what you think is next for this technology? Like how does it need to be developed further, and what's needed for that to happen?
So at the moment, we are providing something which essentially, to go through the regulatory process, for example, you need to shovel wood chips for 2 minutes and show that the airflow protection is good. You need to be able to fire a ball bearing at the visor, and the ball bearing needs to bounce off. So there are a whole lot of features which make it suitable for an industrial setting, which are not necessary for a healthcare setting. So for me, something which is lighter, quieter, maintains exactly the same level of protection is the direction of travel. I don't think we're ever going to get away from the fact it looks a little bit silly. But for societal use, Hal Morgan, the engineer who worked very closely with me and also was given a royal honour for the work, has suggested that for societal use, you may just need a visor with a clean airstream going down. You don't actually need everything else. And it would be quite easy to design. It would almost be like just a cap where the tube comes down, you have a visor. And for people who want to take the tube to work, or who want to wear it when they're shopping. So one of my friends did send me a picture of one of the porters wearing a PeRSo in Sainsbury's Southampton, because they were going shopping and they didn't want to get coronavirus. And it's probably worth saying that there are still porters now, 5 years later, who are still wearing their PeRSos because they've got into the habit. But unfortunately, at the moment, you could not construct one of those because of the regulation. So for me, the direction of travel has to be, the regulations need to change. And then, because at the moment it's not a particularly strong commercial offering, it has to wait until the next pandemic comes. The government needs to incentivize people to develop them now. If we wait for the next pandemic, we'll be in the same situation. It's probably worth saying that most of my colleagues, like me, have still got their PeRSos hidden underneath their desk because they don't want to return them, because we want to be better prepared for next time.
Mm-hmm. Yeah, and I think that's one of the themes that's kind of come up in the inquiry is this idea that it's not a question of if there's another pandemic, but when, and the concern that we are equally unprepared this time, having not learned those lessons. So you kind of mentioned the need for the regulations to change and the government to incentivize that. If you were going to send a message to the government now, what steps would you want them to take practically right now that's going to mean that development can happen?
So, I mean, my point to the government would be all the traditional infection control steps of isolate, test and trace, develop a vaccine worked, but they took too long to work and it was too slow. And this wasn't a particularly pathogenic virus. I know lots of people died, but in actual fact, if the next virus has a 1 in 10 mortality, it will be completely different. So we have to say what intervention can be deployed immediately. And I would put it, the powered respirators is one of the things which can be deployed immediately. So we need to actually get the design correct with users, industry, and all the key stakeholders involved. We then need to build a stockpile so that then we have something robust. The great thing about powered respirators is once you've given it to someone, they use it for 3 months. It's not like this constantly dripping tap where you know you're going to run out. And I would say go one step further and do the regulatory requirements for a commercial product, so that in the same way, if you have an umbrella and if it's raining, you put your umbrella up. When the news comes of a new virus which is circulating, you can say, I'm just going to put this slightly funny hat on. I'm going to wear it for a few days. And if it's just a false alarm, that's fine. You looked a bit silly. But we've got a way of UK as a society keeping going. We don't need to shut down because we've actually got a sustainable and effective form of PPE. Anyone who's worn an FFP3 mask for more than half an hour know how uncomfy they are. They just are no good. But one of these PeRSos you can wear all day long, and once you've got used to it, it feels absolutely fine.
They've obviously got huge benefits for staff in hospitals, and also you said in wider society. Do you think there's a piece of work to be done with the public as well, with people who maybe don't work in healthcare, around the importance and value of effective PPE? Because there was a bit of a backlash, wasn't there, against masks? Do you think that kind of needs some work as well alongside the actual technology?
I would completely agree that this is not for everyone. There's going to be some resistance. And there is, on one hand, public education and outreach. The flip side is, I think in a free society, there are always going to be a diversity of opinions. But in terms of the modelling, if you have enough people who have chosen to wear proper PPE, that then slows down the transmission enough that it doesn't really matter if a small subset are doing their own thing. It actually feeds into a more free society, because if you give some people really effective PPE, and we could go one step further, one thing we haven't touched on is this filters the exhaled air very well, and we did some tests showing that you don't shed any bacteria by putting it underneath. We have made a prototype where both the inhaled and exhaled air is HEPA filtered. So if you're looking after someone very vulnerable, so for example, a grandparent or someone with immunodeficiency, you're going to visit them, you may want to choose to wear a both inhale, exhale protected one. If the products are in place, then enough people, I think, will do the socially responsible thing purely out of self-interest. They don't want to get it. That if 5% of society is still walking around without PPE, that has achieved the herd immunity, not by vaccination, not by a huge death toll, just by making the equivalent of an umbrella available.
Mm-hmm. So it's really about giving people that choice to actually protect themselves in a meaningful way and protect the people around them.
Yeah, and choose their own level of risk. And I think one of the tragedies I remember from the first wave of the pandemic, I looked after people who had been infected by their carers coming in. and that was tragic. And if you're looking after someone, you don't want to put them at risk, and so it's giving people the protection which allows them to do what they want in life and not endanger others and protect themselves. And there's a whole spectrum there. From an engineering perspective, this is all deliverable, and we've shown it works on a grand scale with 3,500 used in our hospital. But it's not going to come to fruition for the next pandemic without a proactive leadership.
Okay. Well, thank you very much, Paul, for your time and for sharing this important work. And hopefully we'll keep up to date with any developments that you make.
Brilliant. Well, thank you, Lottie, for your time.